Anani Frimpong, who is Deputy General Secretary, Ghana Medical Association. Doc, good morning and thank you for joining us.
Yeah, good morning, Senna, and good morning to all your cherished listeners.
I hope you're well, Doc.
We are managing under the situation.
You've already, in fact, the Ghana Medical Association has put out what do I call it, reservations with the report. For those who have not as yet heard what your thoughts are, what are the issues you have with the committee's work and the proposals they've made thereof?
Yes, let me indicate that we have not issued a public statement on the report yet.
Okay.
What we have done is actually to communicate with our members, the members of Ghana Medical Association, which includes all doctors and dental surgeons in Ghana, on what the national leadership is doing following the publication of the findings of the investigative committee. The ensuing discussions that had followed the submission of the report is a concern that we had raised in some of the media in discussions that have come up. We think that the manner in which this was done, we have concerns with, especially with the publication of the names of the health workers who were at post during the unfortunate incident involving our dear brother, Amissah'S. Very unfortunate, untimely death, and our condolences to the family. We know that two of actually his siblings are members of our association. They are doctors, so we are also grieving. But we think that the focus of the media discussions and all the engagements that are going on should be directed at resolving the systemic problems that we all know are with our emergency health delivery system. The reason that I say so is that we know that in 2018, a similar unfortunate thing happened where a 70-year-old man visited 7 different hospitals in Accra and unfortunately could not get a space and died. So sad. At that time, a committee like this was also set up, headed by the then Director General of Ghana Health Service in 2018. GMA had one representation on that committee. They investigated the matter and they made very good recommendations, similar to what the this new committee had also brought up. 7-8 years down the line, what has happened to the recommendations? And yet, this unfortunate thing has happened. So it tells us that it is not scapegoating the health professionals that will solve the problem. There are real issues that ought to be addressed. And the media, the civil society organizations, the authorities at the Ministry of Health, Ghana Health Service, and all other agencies involved in healthcare delivery, including the government, should focus on those systemic issues and address them so that they can assure every citizen anywhere in this country that if you require emergency health service, if you walk into any hospital in Ghana, you are assured of quality, robust, and prompt emergency health delivery, and to assure you of a good outcome. Without that, scapegoating the health professionals and leaving the issues, the systemic problems are still in place will mean that we'll have an unfortunate recurrence of similar incidents. Let me indicate that there are also other people that may not have lost their life, but they have also come with complications because of maybe the delays and the problems we have with emergency setup. So there's work that the government and the duty bearers at the Ministry of Health, Ghana Health Service, and hospital managers, they need to address so that the frontline health workers can work in a system that is supportive and will help them to be able to deliver with the knowledge and the skills that they have. As we sit now, most of our nurses and doctors and other health workers who work in an emergency setup are sacrificing under very severe challenges, and they keep on improvising every day. The challenge is that when an unfortunate thing like this happens, now we want to judge them by textbook standard of care stuff that are in protocols, and yet we have not designed a system that actually is textbook or standard practice for them to work in. And if you do that way, you are not being fair to the health professional who is working in such compromised system. So let's look at redesigning and reforming our health delivery system so that any qualified health professional put into that system like we have in the advanced countries, you can deliver. Let me indicate that Ghanaians who are health workers, who are trained in Ghana, when they go to advanced settings, because they have well-oiled and also well-designed system in terms of their health delivery emergency, they excel. So it tells you that it is not the health professional per se. It is the system and how we have set up our emergency and other health delivery systems. That is where the challenge is. And if you address it, we will be better off as a country. And so we want to encourage the media, the civil society organizations, that let's focus attention on the main systemic issues that thankfully the committee has identified. Let's monitor the implementation of the recommendations, taking accountability every month, every 3 months, every 6 months from the duty bearers, the Ministry of Health, the head of the Ghana Health Service, the directors there, the hospital managers, and the administrative staff. They are responsible to make sure that there's a functional system that the health professionals are working in to deliver their best. We do not oppose accountability of health workers, and we think that we should allow the process to go on as we have referred those that the committee feel they have played a role in the unfortunate death of our brother. The only thing is that we should make sure that just like any other investigation or any other disciplinary process that we have, the process is evidence-based, it is transparent, and there's fair hearing, and it is in accordance with due process of law as our constitution stipulates for every citizen. Once those things are going on, which we know that the administrative setup and the regulatory agencies can handle it, let's focus as a nation on reforming our emergency health delivery system so that you and I can walk into any hospital and be assured that we'll get prompt and quality emergency health care. Otherwise, unfortunately, we'll come back to this whole thing a year, 2 years, 3 years, 4 years down the line.
And Doc, to be fair to the committee, they also admit the systemic challenges and made some proposals as to how to address them. The other leg is also that they found that some of these professionals in question, failed to do what they were supposed to do, the basic that they were supposed to do to save the life of Charles Amissah. These are not issues that are systemic. In some cases, they even suggested that some of them plainly lied to the face of the committee members. And the person who chaired this committee is none other but Professor Ajimambedu Akosa. It is not a journalist. Prof is a medical professional. Are you doubting that this committee had what it takes to look at the practical aspects of your work? Because we're talking about applying textbooks. Are you doubting that this committee understood your work and did an assessment that is acceptable to you?
We, as Ghana Medical Association, have not received a copy of their report. So we are opening up channels to try and secure an official copy of that report. That will help us to study the findings and see how the processes were and how some of the conclusions were arrived at. At that point, we will be able to make comments on how the committee conducted its work. At this stage, I'm unable to say so.
But to what extent are you also taking into consideration the fact that the members you represent are human beings, that sometimes there could be issues that you can blame them for and not the system?
That there are administrative and other measures in place to detect such people, and then they are also taken through the necessary disciplinary processes, just like any other system. In journalism, all the journalists are not the same standard. The police service, they are not the same standard. So every professional, every group of professionals, there may be issues. And that is why we have systems and administrative processes in place to pick out those ones and address them as and when they come, so that all of us fall in line. And so we are not opposed to any of those accountability measures concerning health professionals in this country.
And I guess what you're asking for from listening to you earlier is that these processes must be fair.
That is all that we are saying. It must be according to due process of law, and it should be transparent, evidence-based. And just like the process of natural justice says, they should have fair hearing in all these processes. That's our only concern.
Okay, so let me conclude with you by then asking you, and we're hoping that after you've looked at the report, perhaps you share with us what your own thoughts are. Then we can have a much more extensive conversation on it. But you talked about the fact that something happened in 2018. You were involved in a committee. In fact, there was a member of the GMA that was on the committee. Proposals were made. Then there's this investigative report. What do you expect to change?
So what we expect is that we work in the emergency setting. We work in the hospital. Some of us have opportunity to also observe how health care delivery, especially in the emergency setup, in other advanced settings are. Our system is not suited for purpose. It's not fit for purpose, especially with our emergency setup. And so we need to redesign it. We need to reform certain aspects of it that will assure our quality. Let me indicate that at this point, many of the health professionals are actually improvising. They do not have the needed equipment, the needed resources, the logistics that are needed. Our emergency centers for the various hospitals are very small. The district hospitals and the regional hospitals, this is also most of the places, probably about the maximum you may get is maybe 10-15 bed capacity for the emergency. Most of them are around 3-5 beds for a whole district. The whole of Greater Accra region, of a population of closer to 6 million people, close to about 200 or so emergency beds. Well, is that adequate for the population that is supposed to serve? So there are huge issues. Then it comes to staffing. In emergency centers, we need adequately trained and specialists in the various grades, nurses, emergency nurses, critical care nurses. You need emergency specialists and physicians. We will need other cadre of staff to man these emergencies with the required tools and then logistics to deliver the health care. Our national ambulance service, they provide what we call pre-hospital care. In this case, for instance, we expect that, like we have in other systems, when they call an emergency response is dialed and they are coming, they are able to deliver some basic health care in stabilizing the patient at the point in the home or on the roadside, like happened to our brother. While on the way, they should be able to provide some emergency stabilization of the patient, so that the things that will compromise them to the extent that a patient may die in the way, they will be able to stabilize and stop some of them. Our emergency national ambulance system, as it is now, are not able to deliver that basic stabilization en route. And so the longer they stay in the vehicle or transport, the more compromised the patient may be. They should be able to, for instance, set an IV line, put on some drip, They should be able to do blood transfusion. And if, for instance, a patient has been referred from secondary Accra, they are coming to Accra on the route and he's bleeding, they should be able to stop the bleeding. Basic stuff, because those are the things that actually will compromise the patient, so that by the time they go to the hospital, the patient may have worsened to the stage that you may not be able to do anything. But our pre-hospital healthcare itself, we need to pay attention to it. Make sure that the EMT, the emergency medical technicians, have the adequate skills, they have the resources and the mandate to be able to at least provide these life-saving interventions in the ambulance on the way. If there are resources, logistics that they are needed in these ambulances, let's equip those ambulances and train them to be able to do that, so that in emergency settings, the longer you wait, the worse the outcome. Then we talk about the bed availability in terms of emergency healthcare as well as the ICU. How many do we have? And then how are we able to, for instance, know that I am in Accra, I am in Medina, and the patient has to be referred for Medina Polyclinic? Which hospitals shall I send to? Which hospitals have available emergency beds or ICU, unique ICU care, ICU beds? We should be able to have a system that at a command center on a dashboard, I'm able to say that, Greater Accra Regional Hospital, we have 5 emergency beds up at now, 2 ICU beds up at now. Kolebu Teaching Hospital, we have 10 emergency beds up at this morning. We have 10 ICU beds at this point. All the other major hospitals, so that the National Ambulance Service, once they receive the call, they will quickly dial to the emergency command center that has a dashboard, and the officer in charge will be able to tell them that, go to this hospital. Based on the condition of this patient you are reporting to us, they have emergency beds, they have the available staff to be able to deliver healthcare. So straight from Medina, they move straight to that hospital that has a bed. And not like the system we are in, that the National Ambulance Service take a patient, unfortunately they don't know which hospital have beds, and they keep on moving from one hospital to the other. At the end of the day, the patient gets compromised. By the time they get a bed, the patient already compromised. So we need to work on those areas. And a key part that I want to also mention, which I'm happy that I think in the recordings that we also went through from the investigative report, their publication, is this emergency fund, which we support. There are things that we have recommended in the past. As it stands now, on weekly basis, we have patients that are hit and run vehicles, and are hit by vehicle, and then they are left at the roadside. Good Samaritan or ambulance service brings them to the hospital, but they are not relatives. So how are we supposed to fund the emergency care? The hospitals, most of them, will have a system in place that will, at least the first 24 hours, they want to try and then provide the basic health care that you need to make sure that you are alive and then to save the patient's life. Beyond that, relatives have income. We don't have a dedicated funding source for emergency health delivery system. And in this age, when we are talking about universal health coverage, where we are saying that they should have access to quality health care without financial barrier, the most critical aspect of our health delivery system that should be able to assure that without financial barrier should be emergency center, because if you will survive or die, it depends on the quality of emergency service and the availability at the time. So we should have an dedicated emergency fund that will take care of every patient anywhere they find themselves in this country, in any hospital. Once they report, whether to a private hospital or a public hospital, that funding source should be available so that it assures them of the financing of their health care. Then the hospitals and then the other providers will also put in their best to provide the quality health care. Sometimes in emergency setting, they need something like an MRI, which is quite on the high side, a CT scan, to be done immediately, and it is needed to make decisions on what treatment to give. If there's no funding for it, it may delay, and that also may delay the care, the quality care that the patient may receive. Some basic will be done, but the definitive things had not been done. All these things end up choking our emergency settings, so that somebody that has to expect that within 24 hours, every emergency case that comes to the emergency room should be moved to other wards to create space for new ones that are coming in. They end up choking these emergency centers and occupying the beds, and the place is congested. Now, we don't have space to admit new patients, and that's what leads to this no bed syndrome. So there are real problems, and there are real solutions that has been proffered. The key thing is that the duty bearers, the Ministry of Health, the Ghana Health Service, the directors there, the managers of our hospitals, they have the duty to make sure that these recommendations are implemented. And we as citizens, we as media, we as civil society organizations, we should monitor the implementation of these recommendations. And when we do that, with the accountability process, we think that we'll make a headway so that you and I, who are all at risk, anytime we walk into a hospital requiring emergency services, we'll be assured that we'll have prompt attention, and that will be good for our country.
Doc, thank you. Thank you very much.
You're welcome.
Well, so that's Dr. Dan Anani Frimpong, Deputy General Secretary, Ghana Medical Association. Their main focus is on their members whose names have been mentioned. But what they ask for is fairness in the process. Taking us exactly 9 a.m. There's a few things to do. We'll take a break.